We wrap up Disc 1 of ACCEL with a unique story. Dr. John Camm is joined by Dr. Randall Thompson, professor of medicine at the University of Missouri, to discuss atherosclerosis across 3,800 years of human history, the Horus Study of 4 ancient populations.
This is an unusual paper, Randall. Tell us how you first started with this.
Thank you for having me. The study started actually 3 years ago when two of my colleagues were in Cairo, and they came upon the placard for the mummy Merneptah in the royal room of the Egyptian Museum. And the placard said that Merneptah, who by the way was the pharaoh that followed Ramses the Great, that he had died in his 60s and had dental problems, arthritis, and atherosclerosis. And none of us believed it. We thought, how would they know in the first place? And besides, atherosclerosis is a disease of modern humans. So because of this doubt, we proposed that CT scans be done on Egyptian mummies. We traveled to Cairo on 2 occasions in 2009 and 2010. And we published 2 years ago a study on CT scans of ancient Egyptian mummies, 52 mummies, and we found that the calcifications along arteries, diagnostic of atherosclerosis, were present and not hard to find.
I'm surprised that the tissue was well enough preserved for that. That's expected, is it?
You know, it really is amazing. Here we're using a 21st century instrument, multi-detector CT, and we're looking across 3,000 years at health and disease. And the bodies were preserved that well. Just the ancient Egyptians in particular were able to perfect the mummification process so that you can see very detailed in some organs sometimes. It was amazing.
So you studied these mummies in Egypt. That was the first part of your study.
Right, and when that paper was presented, it was critiqued, if you will, that perhaps we had simply found a modern disease in a particular population of ancient people. The ancient Egyptians that were mummified tended to be the wealthier ones who at least may have eaten a very rich diet and not had very much exercise, at least relative to other Egyptians. The question was really, how widespread is this disease in ancient times? And so to approach that problem, to look into the mystery further, we cast a wider net, we brought in more expertise, and we've now assembled CT scans from 137 mummies from 4 different cultures, including some subcultures. We have 51 Peruvian mummies from about 200 AD to 1500 AD, and then 5 mummies from the American Southwest, the ancestral Pueblans, who lived around the area of modern-day Utah, and another 5 mummies from the Aleutian Islands, the Unganans, who were hunter-gatherers. They lived in the late 1900s, and although they are fairly recent, they were living a traditional lifestyle, traditional for them, the kind of lifestyle that they had had for thousands of years.
Are all these different mummies similarly preserved, or are there differences between the groups?
No, we were limited to a certain extent by the preservation of the mummies. The Egyptians tended to be better preserved than the Peruvians, for example, but that may have been by selection. We were trying to CT scan mummies that we thought would be well preserved. And the Peruvian mummies are in a bundle, and they've not been opened, they've not been autopsied or unwrapped. And so we CT scanned just big bundles that we thought would have an adult body inside, and sometimes it was well preserved and sometimes it was not.
And the mummification process doesn't involve eviscerating the corpse or anything like that? They leave most of the organs in situ?
Many of the Egyptian mummies are eviscerated. The heart's taken out. Actually, the heart was only present fully in about a quarter of the mummies. But the North American and South American mummies were naturally mummified. They were not eviscerated. And the common theme is dehydration. Any dry climate, it seems, people have in the past have found that they can mummify their dead and preserve them.
What was the index of atherosclerosis that you were trying to identify?
Well, when atherosclerotic plaque forms, when the disease goes through its processes, calcium is laid down in the artery. We, of course, use that in our modern patients with coronary calcium scoring, or if we have a CT scan for another reason, we'll see the disease in the arteries of the aorta or other vessels. And that was our index. And if there was calcium with an identifiable artery, we said that was definite atherosclerosis. If there was calcification along the course of an artery, we debated it. We had 7 cardiologists and radiologists look at it all. And if we could feel comfortable that it was probable atherosclerosis, because it was convincingly along the course of an artery, we called it probable atherosclerosis.
And what proportion of your mummies did you find, quotes, atherosclerosis?
Overall, 34% of the mummies had some vascular calcifications, including all 4 of the populations. 38% of 76 Egyptians, 25% of 51 Peruvians, 2 of the 5 ancestral Pueblans, and 3 of the 5 Unganans from the Aleutian Islands. And one of those Unganans was a woman who had very extensive coronary calcifications. You would think she would be one of our patients today because of how extensive the coronary calcification was.
I thought that in these more ancient societies, people tended to die pretty young. Did they have long enough to develop atherosclerosis, even the better off of these ancient groups?
That's, of course, true. People in ancient times didn't live as long as we do. Dr. Caleb Finch, who's a biologist, aging expert that's on our team, says that the average age at death was probably about 40, maybe 45 years old for these populations, usually from infections. And so if you live long enough, you might get heart disease, you might develop symptomatic atherosclerosis, but many of these people died younger than that. And the average age of our mummies was about 39 at the time of death. We could estimate age from biologic anthropologic analysis of the bones. We have an expert on the team who does this routinely, and he spent a lot of time going over the bones, especially the clavicle, the humerus, the skull, using what forensic techniques that are available to age the mummies. Although that's a little bit of an imprecise science, if you will.
And I think most of us would have thought that many of these ancient societies that were, if anything, hunter-gatherers, would not have atherogenic diets. So was it something to do with the infectious environment in which they lived that encouraged atherosclerosis?
Well, that's a good question. We were surprised to find this much atherosclerosis in the 5 hunter-gatherers from the Aleutian Islands. And we've thought about risk factors. What about modern risk factors and how they were relevant in ancient times? The ancient Egyptians may well have had a high-fat diet, and the ones that we CT scanned, at least, may have not had very much exercise. The North American mummies in life had indoor fires for cooking and heat, and they may have inhaled a fair amount of cooking fire smoke, and that might be atherogenic, analogous to cigarette smokes in modern times. None of the cultures had cigarette smoking or tobacco smoking as part of their cultures. Infections rev up the inflammatory response. There was a very heavy infection load, very heavy parasitic load in some of these populations. And that's one of our thoughts as well.
This whole topic is a little bit remote from standard cardiology. I imagine you must have had lots of help from other types of scientists and experts.
Indeed, I find that to be one of the most remarkable things about our effort, the remarkable collaborators and how much I've learned from the different scientists that we were able to recruit into the team, especially Dr. Bruno Froelich from the Smithsonian, who really is a modern-day Indiana Jones. Dr. Finch I mentioned, Dr. Janet Mong from the University of Pennsylvania, Dr. Guido Lombardi, a paleopathologist from Peru. Just amazing what I learned from them also.
Randall, this has been an absolutely fascinating interview for me. I had no idea that atherosclerosis was a prevalent disease over 4 centuries ago. Absolutely amazing data, and I thank you very much for this conversation.
Thank you for having me.
And that concludes Disc 1 of ACCEL. For details about studies discussed, refer to the written summary that's included as a PDF file on Disc 3. Disc 2 begins with a discussion on the results from the RATE registry.